welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're talking about diabetic ketoacidosis, or DKA for short. Quick joke before we dive in. Why did DKA crush the party? Because without insulin, the ketones take over. DKA is definitely like a party when you're 10. Okay, so let's dive right into our topic for today. We're going to talk about what DKA is, causes, triggers, warning signs, diagnosis, and treatment. Let's dive right in. So, what is DKA? At a cellular level, DKA is a life-threatening complication of diabetes that occurs when there isn't enough insulin in the body. Without enough insulin, cells can't use glucose for energy, so the body starts breaking down fat instead. That fat breakdown releases ketones into the bloodstream, which makes the blood acidic and can lead to severe dehydration. Now, let's look at the possible causes and triggers. Basically, who is at risk? DKA is most commonly associated with type 1 diabetes, whether diagnosed or undiagnosed. However, it can also result from missing one or more insulin doses or from a faulty insulin pump. Less commonly, type 2 diabetes can also cause DKA. Now, let's look at the risk factors. Certain situations can increase the risk of DKA, especially when the body is under physical stress. These include illness, surgery, infections, and physical or emotional trauma. Certain medications such as corticosteroids or SGLT2 inhibitors may also trigger DKA. Let's move on to the warning signs and symptoms. The early symptoms of DKA can include extreme thirst, frequent urination, similar to the classic symptoms of diabetes that we covered in our last video. So go check that out if you haven't already. So alongside those symptoms, you might also see signs of dehydration, such as dry mucous membranes and flushed skin, increased hunger, ketones in the urine, and elevated blood glucose levels. As DKA progresses, more severe symptoms can appear, including nausea, vomiting, abdominal pain, and there are some hallmark symptoms of DKA, such as Kussmaul breathing. This is a critical hallmark symptom of DKA. It's that rapid deep breathing that occurs as the body tries to compensate for the acidosis by expelling carbon dioxide. The second one is that distinctive fruity breath that results from the breakdown and accumulation of ketones in the blood. In severe cases, DKA can eventually lead to confusion and loss of consciousness. Now, let's talk about diagnosis and monitoring. How do we recognize that a patient may be going into DKA? Usually, when a known diabetic presents, we start by checking a venous blood gas to assess acidity levels. A pH of 7.3 or less is a key indicator. We also look for low bicarbonate levels of less than 15 to 18 millimoles per liter. We check the urine for ketones and check the blood sugar. A level of 14 millimoles per liter or higher may indicate that the patient is in DKA. We also closely monitor electrolytes, especially potassium, which can drop to dangerously low levels during a DKA episode. After diagnosis, monitoring continues. We need to keep a close watch on the symptoms we just discussed, such as the Kussmaul breathing and the level of consciousness, while also constantly monitoring that blood sugar and lab work and continuous venous blood gas to guide treatment. Now, moving on to treatment, the goal is to reverse the cascade. First, we address dehydration by aggressively pushing IV fluids. We replace potassium levels if levels are too low, and we give insulin infusion via IV to reverse the process and bring blood sugar back to normal levels. During the insulin infusion, blood sugar should be checked continuously, usually within 1 to 2 hours. One critical point to remember is that potassium must be replaced and brought to adequate levels before starting insulin. Okay, that brings us to the end of the main content. Let's go through a few recap questions. First, which breathing pattern is identified as a hallmark symptom of DKA as the body attempts to correct metabolic acidosis? The answer is cosmal breeding. Second, which medication class is a potential trigger for the development of DKA? The answer is SGLT2 inhibitors. And lastly, what causes that fruity odor on the breath of a person in DKA? The answer is the production and accumulation of ketones in the blood. That's it for today's video. Let me know in the comments how many questions you got right. If you found this video helpful, please like and subscribe, and I'll see you in the next one.